This patient was referred to me for examination of tooth number 19. Patient is a medical doctor himself. And according to the patient, this root canal was done a few years ago by his previous general dentist. Recently, tooth started to hurt. Also, tooth hurt to biting, chewing on it, and patient stated that when he would touch right below the tooth on his gum, there was some pain and tenderness as well. So take a look here, tooth number 19. You can see a crown on the tooth. You can see previous root canal. You can see a pericordial lucency right here, overextended material here and here. It doesn't matter. Look, there's overextended material here. There's no pericordial lucency. Again, remember, the extent of obturation doesn't affect in a negative way the outcome of endodontic treatment. What affects the outcome of endodontic treatment is not the extent of obturation, but presence or absence of microorganisms in the canal. So if you got microorganisms in the canals and their byproducts, you get abscess infection like this. The distal root doesn't have any microorganisms or the byproducts in it. And as you can see, overextended material, no pericordial lucency, no issues, no problems. All right. So I talked to patient about options, redoing the root canal with guarded prognosis versus extraction. Patient decided that he wanted to try to save the tooth. So that's what we did. We went through the crown here. These were these plastic thermofood carriers, 3 of them, that we were able to remove. I've made videos on how I remove these, but before I proceed, I want you to pay attention to the prep of these canals. These are classic Coke bottle preparations, and these are an indication of the fact that this dentist used case Glidden drills. So he aggressively removed a lot of dentin here. We can see the Coke bottle preps. Too much dentin was removed. And as I said, these were plastic thermofood carriers that we were able to remove. And here is the, I just wanted to make sure that I had the lengths correct. So this is my cone fit PA, just to make sure my cones are fitting and going to my desired working lengths. And here's the post-op. As you can see, everything went beautifully. Here's another angulation. Everything went beautifully. And again, we did this in one appointment. We went ahead and temporized the tooth and referred the patient back to his dentist for the permanent restoration. In cases like this, I always tell the patient, go to your dentist right away. Have your dentist replace my temporary filling with a permanent filling. Don't get a new crown yet. Come back and see me in 6 months. I want to make sure that pericordial lucency is healing or healed before you spend more money on the tooth. So when patient comes back in 6 months for a post-op, I will post that video. Hopefully this has healed